I'm here with Francis, the CEO of Carea Community Health Centre. How are you today?
I'm doing fantastic, and thank you for asking.
Perfect. Thank you for being here. First of all, could you please tell us a bit more about Carea Community Health Centre, your services, and the community that you serve?
Sure. So I'll give you some context a little bit. Carea Community Health Centre is an organization that was born 2015 November 1st. And it's an amalgamation of two smaller CHCs. That was the Oshawa Community Health Centre and the Ajax Youth Centre, to form a new organization called Carea, which simply means care in the area. That's where our name is born from. And our mandate is very clear. We have been given an expanded mandate by the ministry to cover the 4 municipalities of Durham, which are the municipalities of Oshawa, Whitby, Ajax, and Pickering. We border with Scarborough right at the Rouge Valley extension. And our population, priority populations, are newcomers to Canada, Black, Indigenous, LGBTQ+, and anyone who is living considered to be, experiencing barriers as low income, etc. And those services that we are giving in those areas, it's a breadth and an expansion of services that range from primary care services, wraparound case management support that includes food security, support in the precariously housed or sheltered, into finding them opportunities to get spaces to rent, as well as the after-school programs that we run, and also supports with transportation to make sure that people can access the services that they need.
That's amazing. We know that Ontario is fortunate to have a large number of community health centres such as Carea. They receive core funding from the provincial government along with some other occasional funding from federal and municipal governments. But do you still see gaps in terms of individuals and groups that don't have access to community health centres but would benefit from access to a community health centre, which would be possible due to all of that funding?
Yes, definitely. If I was going to recommend to the government the best model of care, I would say a CHC model of care is the best model out there. Specifically, when you look at what we are dealing with throughout the pandemic, and even what we have learned prior to pandemic and the experiences we have seen during the pandemic, is most of these services that are out here that are preventative, that are also population-based approach, that are also services that are in tune with the needs of the community, are a reason why we notice even some early wins during the pandemic, in which even the testing, the vaccination for the most, I would say, challenging to reach communities, the services of a CHC will be greater. So for those agencies or communities that don't have a CHC, you can pretty much name an endless list of barriers that they will face when it can come to some challenges that they would have in terms of accessing the just-in-time care. And I know you hear a lot of conversations regarding primary care gaps, not finding a physician, not finding a nurse practitioner-led clinics to support, the care. As much as all those are actually crucial and important, there are other actually elements right underneath it that addresses the social determinants of health that could be addressed under a CHC model. So if there was more expanded funding coming from the government, the provincial government, in collaboration with the feds, you can definitely see the diversion of the ED or emergency department visits being visible in the statistical collections that you see with the people that will be intercepted via a model like a CHC model.
Absolutely. As you mentioned, the pandemic, it was a difficult time for many community health centers to adapt and continue to meet the needs of their clients, yet they all persevered. Can you speak to the impact your community health center made during the past 2.5, almost 3 years of the pandemic?
Definitely. I could write a book on that. So kudos and the support and also the involvement of Catch to support us during that time with some of the COVID relief funds that we got, but also spreading the message in terms of what the role of CHCs were doing at that time. So if I turn my attention to what Carea has done, first of all, we never closed not for a day. When most of the services across Durham region, from Tim Hortons, libraries, all those areas were shut down because of what we all know as the most challenging time of COVID. So Carea kept their doors open, in providing over 90,000 pounds of food that we ended up actually getting into the business of doing. Because in our mandate, addressing food security and also, some of the case management is not specifically within the mandate, because we work in collaboration with food banks who are very clearly funded for those elements. But in our areas, because schools were closed, most of the families would benefit with kids, supported with food programs in schools at those times when the schools were closed. That was a huge void that we had to bridge on top of other medical supports and also case management supports that we were doing at that time. But also what we have done more spontaneously was the ability to pivot into the virtual care approach, which we ended up actually setting, within 2.5 weeks. We were already turning some of our appointments into virtual appointments to allow the community to access us. And more importantly, we ended up forging some partnerships with private corporations like TELUS, Mobile Mobility, in which they have forwarded to Carea in that partnership a huge number of digital devices, Android devices that included iPhones with free data, free voice, and video subscribed to be able to be used by our clients. So we went into the community and reached out to folks that we knew would need these devices on a loaner partnership. So we loaned those devices so that they could continue to access care and services, anytime they needed. Because most of the places where they would get, say free Wi-Fi or Wi-Fi in their buildings, some of them couldn't afford to pay because they were not employed. But we have also, in Durham, done something uniquely important in setting what was the isolation center, partnering with a hotel, which is the Holiday Inn, and making sure that the entire 133 rooms in there were protected for any family members who needed safe isolation. Foods were provided there as well, including sometimes picking medications for those families from the pharmacy so that they don't have to leave their hotel room since they were, infected or were symptomatic with some of the COVID symptoms. So those services became actually a true testament of the value add that CHCs can be able to spin within a short period of time in meeting the needs of the community.
That's amazing. Congratulations on all of that success during such an incredibly different time. I think some of my favorite parts of this job are hearing these testimony of how amazing community health centers have been across our whole country during such sincerely unprecedented times. As you mentioned, Carea operates a number of services and programs that focus on people's determinants of health, even beyond healthcare. As you mentioned, food security, early year supports for children and parents, and other upstream supports. Do you see particular areas where increased federal investment in community health centers would enable you to increase your reach and further improve the health and well-being of people in the communities you mentioned?
Definitely. To start to name a few, if there was an additional funding, you can definitely understand the gaps that we do have today when we look at segmented population, right now we have huge challenges in mental health and addictions. And mostly we call them the two ends of the spectrum, youth, children and youth, as well as on the other end, seniors who are frail or at risk of frailty. They get to be the two most completely vulnerable, populations in that segment also that would need, a very deliberate approach or plan to make sure that they can continue to be reached. We are noticing that, especially right now with the reopening of services and keeping Ontario open for these services, some of these population segments that I'm talking about, the element of navigating what's where and how to get those services continues to be a challenge. But also the olden days of brick and mortar services, we need to kind of approach them with a little grain of salt, because if we are truly saying we need to bring the services where people are, some of these services could actually be provided not only in virtual environments, but in also mobile environments that are in tune to those services. Carea is one of the lead agencies in Ontario. It's 17 lead agencies since, I want to say, December of 2020, when we got appointed through the ministerial order. We are in that phase of right now building what does that mobile unit look like, so that at least we bring the service right to the front door of these communities that need these services. Because when you think about what stops people from accessing care, one big part of it is the knowledge and the navigation of where those services are. Transportation barrier to get to those services is also a huge challenge. But also the actual finances to be able to get to those services and pay for some of those services where they are not provided by a CHC is also a challenge, which I think with any injection of investment by feds would allow us to really look back into how do we make sure that we remove those barriers through some of these investments to make sure that everybody who needs the service, everybody who is in those categories that I spoke about, can be prioritized into the services. And it totally serves the system, eventually when you look at what exactly we are doing ahead of those times. So which means that individual who was supposed now to be now either calling a 911 for support or driving or getting into a bus to go to the next ED, that trip is saved. And that trip, the amount of funds that could be used in there could be redirected way ahead of time to do other things that are much better.
That's amazing. Perfect. Of course, us at CACH, we agree as well that increased federal investment would help so many different community health centers do so much amazing work. And I really want to thank you for your time speaking with me today, Francis.
A pleasure, always. And we hope with the direction that we are going through right now, there could be an opportunity to see what exactly are the lessons that we have learned through COVID, and how can we take those lessons and apply them in the current challenges that we have with the shortages with health human resources that we are facing. And I think this is not news to you. It's not news to anybody out there who may be listening to this, that CHCs are one of the sectors that, in the last provincial budget has not gotten any best funding for the services that we give. On top of that, we are also experiencing a little bit of handcuffs from Bill 124, which is still in effect, which would mean the retention and the recruitment of already the well-needed workforce to support these communities becomes a challenge. Mm-hmm. And then the ability to be able to address these gaps that I mentioned earlier, without the supports, without the resources, is completely challenging. We are a human capital industry, a person touching the client or touching the patient, and also the person receiving. There has to be that part of reciprocal ratios that could allow us to operate that way. So we are hoping, in your advocacy, you can push and ask for those supports, for the feds and the provincial government to consider in an investment into this direction to allow us to do the best work we can do. And thank you for your time, Hilary.
Of course, that endlessly, that is our goal. So thank you so much for adding that point, and thank you for your time today.
Not a problem.